This video will show how to don and doff the protective equipment, including the CAPR respirator, needed when caring for a patient with confirmed or suspected novel coronavirus, or COVID-19. A few key points about personal protective equipment. Be sure to don your PPE before entering the patient room. Use your PPE carefully to avoid the spread of contamination. You'll need an isolation gown, gloves, and a contained air purifying respirator, CAPR for short. The sequence for donning PPE includes putting on your CAPR belt and battery first, isolation gown second, followed by your CAPR respirator, and finally, your gloves. First, don your CAPR belt and battery. The battery goes on your right side with the battery port facing backward. Next, don your gown. When donning a gown, be sure to select an appropriate type and size. When you put the gown on, put it with your head through the hole so the opening is in the back. Do not tie the gown yet. Next, connect the battery cable to the battery. Do this by lifting up your gown to expose the battery. Plug the cable into the battery until you hear a click. Then ensure your battery indicator lights are functional. Initially, the unit should show 5 LEDs from left to right. 1 yellow, 3 green, and 1 red. After a few seconds, the lights will ideally show 3 green LEDs. 3 green lights indicate a 75 to 100% charge. 2 green lights indicate a 75 to 50% charge. 1 green light, 25 to 50% charge. 1 red light, 0 to 25% charge. 1 yellow light means there is an issue with the filter or airflow. If at any time you see only 1 red or yellow light, doff the system as soon as possible. Next, don your CAPR helmet. First, you must loosen the headband adjustment knob. This will ensure the circumference of the headband is as large as possible to ease the donning process. Next, attach the disposable lens cuff, or DLC. Most individuals can use the medium-large cuff. However, a small to medium size is available. Attach the disposable lens cuff to the 3 mounting points on the helmet. Remove the protective film from the lens cuff. Next, don the headband over your head. Then locate the cuff and pull it around your face and under your chin. Run your fingers around the cuff to ensure slight tension. Check to ensure the helmet is on straight and positioned correctly. For correct position, the head strap should be about a ½ inch above your eyebrows, and you should be able to see the indicator lights in your peripheral vision. Tighten the head strap knob by turning in a clockwise motion. Tighten the headband to ensure a secure, comfortable fit. If you cannot get proper fit, you may need to adjust the head strap assembly. To adjust the head strap assembly, pull the headset from the snaps on both sides and reset to a taller or shorter setting. Next, move the cable behind your back and tuck it under your gown. Next, tie your gown. Last, don gloves. Choose the correct size glove. Pull the gloves over the wrists of the gown. Once your PPE is fully donned, check that all PPE is on correctly and fully secured. When you are in the patient room, do not touch your face or adjust the PPE. Don't reach under your gown for any supplies. Remove PPE at the doorway before leaving the patient room, with the exception of your CAPR respirator. The respirator should be removed outside of the room and after the anteroom door has been closed. Be sure to remove PPE slowly and methodically. When removing your isolation gown, pull forward to break the tie at the waist. Grasp the gown at the front and pull away from your body. Do not grasp the gown at the neck, and do not place your hands inside the gown. While removing the gown, fold or roll the gown inside out into a bundle. As you're removing the gown, peel off your gloves at the same time, only touching the inside of the gloves and gown with your bare hands. Dispose of the gown and gloves. Perform hand hygiene. Prior to removing your CAPR respirator, detach and dispose of the lens cuff. Unplug the system. Loosen the head strap and pull the helmet up and away from your face. Perform hand hygiene. Remove the belt and battery. Perform hand hygiene. Wash hands with soap and water or use an alcohol-based hand rub. Perform hand hygiene immediately after removing PPE. If hands become visibly contaminated during PPE removal, wash your hands before continuing to remove PPE.